Let's jump into chapter 10, another important, well, I guess all chapters in this book are important, but this one's a big one, and another chapter that covers the majority of healthcare workers, if you will. Learning objectives are listed here and on page 189 in the book. Books start with a paragraph. The chapter starts out with paramedics and first responders, those different roles that are listed here. And paramedics is listed on page 191. The paramedic is an allied health professional whose primary focus is to provide advanced emergency medical care for critical and emergent patients who access the emergency medical system. So these are the people, along with EMTs and EMS, they arrive for their first on scene. So by the time patients get to the emergency room, a paramedic or EMT have stabilized them. So they're very important in the emergency care system. Paramedics, I flipped my slide. Page 191, it talks about all these items here, so be sure and read that. The emergency department, page 192. This is a high-risk area that tends to be a main source of lawsuits, and we'll get into why. The book does a great job of that. The objectives of the emergency care system are listed here and in your book on page 193. The case here mentioned is no duty to patient who left ED untreated. Be sure and read about that. Failure to admit, yes, that's a real thing. Documentation. I feel like this is getting ahead of... No, it's not. It's okay. All right, so this is following the book. Okay, so EMTALA is what this acronym means. It is the Emergency Medical Treatment and Active Labor Act. So there's reasons for this. Back in the 70s, 80s, and even sometimes in the 90s, it still occurred, where patients would come into the emergency room and hospitals would send them to different, hospitals say we can't take them, or anyway, so you can't do that now. There's specifics in this law, so be sure and read this. But EMTALA forbids Medicare participating hospitals from dumping patients out of the emergency room. You cannot discharge somebody based on their ability to pay. You can only discharge a patient if they're ready for discharge. Again, read about that on pages 193, and it goes over to 94. Actually, even continues on to 195. So these are text cases. Of course, inappropriate transfer, failure to admit. Same thing, you have to admit a patient whether they have the ability to pay or make their co-payment. Even if they're a foreign alien, if they're not a U.S. citizen, you cannot deny patients care for those reasons. So read that. Also, another case, fatal mistake, wrong record, duty to call. So all of this is in your book. Yes, okay. Sometimes going back between the slides and the book gets a little confusing. This is following right along in your book. I'm just not going to read it to you. Page 196 is where the duty to contact on-call physician. So this is, if you are an on-call health provider, you have the duty. You can't just say, oh, I didn't hear my phone ring, or I didn't get the message, or I didn't. You have to do that. If you do not, and there are negative outcomes, then you will be held liable for those negative outcomes. The book talks about the telephone medicine. Keep reading these. Preventing ED lawsuits. Of course, there's a great way to prevent them by having improved care and expectations within the emergency room. Communication is very key here, and triaging, having a way to triage and having a guide on how to triage. And don't ever take a patient's complaint lightly. You really have to assess and get to the bottom of what somebody is saying. All patients must be treated, knowing when to admit or transfer a patient, because there's so much legal liability around that. Improper transfer is one of the cases here. Laboratory services. So this is another very important medical department or hospital department within the healthcare system. It provides data. It does testing on blood, tumors that are removed from somebody's body, foreign objects that are removed out of somebody's body. So the lab is very important, especially when it comes to blood test results. That's how we get many of our diagnoses. Somebody comes in complaining of chest pain. and their EKG is normal, we still do blood work and send it to the lab to check for high troponin levels, see if they're having a heart attack or see if it's reflux instead. Importance of laboratory results in pending stroke. Yes. That's another, I didn't mention that, but that's one of the responsibilities of the lab. All right, continuing on, I'm going to keep, I just flipped the page. Let me go back. So I flipped the page in the book. The mismatched blood is a huge ordeal with a lot of liability. Within the past decade, I believe, there was and I may have mentioned this before in another video, but a patient flew in from another country, arrived at Duke University hospitals in Durham. Young child, pediatric, raised a ton of money to have this transplant done. Transplant was a success, except they gave the patient the wrong blood. I never heard if it was mismatched blood, or if a nurse hung the wrong blood, or if the lab provided the wrong. I never got to the bottom of it, but that was a huge news story back when that happened. Okay, so flipping the page in the book, 202, we start talking about medical assistants. These are people that are unlicensed. They go to a course that, again, like a nursing assistant, can be 3 to 6 weeks in length, and they help in many, many different areas. Current today times, orthopedic offices have medical assistants. Maybe even your primary care doctor does. Cardiologist, if you go to a cardiologist or asthma doctor and you walk in, that is not a nurse, that is not an RN in their office. Okay, it might be on a rare occasion, but usually it's a medical assistant. And do you know why that is? I mean, we know, right? It's nothing to be ashamed of, but it's budgets. It's a medical assistant's salary is probably 1/4 of a registered nurse's salary. So if the doctor and the healthcare facility can run with the help from a medical assistant at 1/4 of the cost, then that's definitely a budget-wise decision. Okay, nutritional services. There's so much important with nutrition within a healthcare facility, like a hospital. Obviously, nutritional services may not be a big deal in a small medical office, but read about how nutritional services is responsible, especially failure to provide the proper nourishment. Pharmacy. This is another big, important medical department within a hospital facility. Giving somebody the wrong med, or mixing the med wrong, or not providing the instructions that it should be crushed or should not be crushed, because it makes a difference how the body uptakes it. This is very important with pharmacies. You can read about that. Common prescription errors. Yes, that does happen. Sometimes it is because of abbreviations and not being able to read the handwriting. But in today's time, most of everything is computer generated, but that also allows for errors. Instead of giving an antibiotic once a day like it should be done, someone may accidentally transcribe it into the computer as twice a day, and it is the pharmacist's responsibility to confirm that. And again, if it lands in the hands of the nurse and the nurse is never given 2 of those antibiotics in one day, the nurse has the responsibility to ask and confirm. So we're all in it. It's everybody's responsibility to prevent medication errors. It's also a patient's, but not within the hospital setting. What I mean by it's also the patient's, when it comes down to it, if you go to your local pharmacy and you pick up a medicine, and let's just say your doctor verbally told you to take it once a day, you pick it up from the pharmacy and it says 3 times a day. You, as a healthcare consumer, as a patient, you need to stop and confirm the correct information. We all make mistakes, but liability-wise, that would definitely go back on the pharmacy. Okay, so dispensing errors, you can read that. Documentation, control drugs. So this is a whole different, gosh, we could have a chapter on just this alone. But page 205 explains this very well, so I'm not going to supersede that. Decreasing med misadventures. Yes, there are ways. Decimal points are very important. That can be very confusing because there is a big difference between giving 1.0 milligrams of morphine versus 10. So that decimal makes all the difference in the world. Usually a patient will not stop breathing with 1 milligram of morphine, but if you accidentally give 10 milligrams at one time, you're definitely going to have some respiratory issues that you now have to support and correct as a nurse or any healthcare provider. Role of pharmacist is listed there. And in the book, we are on page 205, 207. Keep on going through here. Limited duty to warn is on page 208. Physical therapy, another very important entity of healthcare. Physical therapy is the art and science of preventing and treating neuromuscular and musculoskeletal disabilities through the evaluation of an individual's disability and rehabilitation potential, and the use of physical agents, heat, cold, ultrasound, electricity, water, and light. And there's a lot still there. I'm not going to read that to you word for word, but that physical therapy is a great career and definitely never a dull moment, because they're always, like nursing and being a doctor, it's ever evolving and there's always something new coming about to try and etc. All right, so let me go back to the slide. Interpreting physician orders, that is a big deal. It's even with physical therapy, honestly, even with nutrition, even with lab, it's just throughout the entire healthcare facility or healthcare system, you have to make sure you understand what your doctor is ordering. Neglect is definitely a part of being a physical therapist. Physician assistant is coming up next. Same thing. The physician assistant is the equivalent to a nurse practitioner if we want to do that. So you in healthcare, you have a doctor, and that doctor has a nurse. And you also, no, I did that backwards. Hang on. A doctor is on the same level, if you will, as a nurse, and then a physician assistant is on the same level as like a nurse practitioner. I'm not doing that fairly, but anyway, that's the hierarchy. Physician assistant, so you have to have supervision of a physician. You can't just go out there and treat and write prescriptions, their scope of practice is defined by each state, and just like nursing, they have their own nursing act or physician assistant act, and you can be held negligible for those. Respiratory therapist, another fantastic career and very, very important role in healthcare. These people are the ones who typically intubate in an emergency. They take care of the ventilated patients, or they're a part of that care. There are not enough respiratory therapists to go around in an ICU. There's 1 to 2 therapists for 30 patients, so the nurses do take a lot of that ventilator care on. But respiratory therapist is the primary caregiver when it comes to pulmonary. Okay. Oh, that's interesting. The book on page 212 refers to physical therapy restocking the code cart. Interesting, but in my facility, the nurses are responsible for doing that. Okay, moving on. All right, licensing healthcare. This is a huge deal. Page 213 goes into the ins and outs and what's expected and how they can grant you your licensing and they can take it away from you for different reasons. Professional misconduct. Of course, some of these are very explicit, but some that are not mentioned. One of them that has come about since COVID is incivility. I'll just mention it because it's not even going to be on the test. But in healthcare, you are expected to be a very professional human being. That has evolved over the years. And when I was a brand new nurse, or even went into nursing school 26 years ago, 27, you couldn't have piercings. And I'm talking about like earrings. You couldn't have tattoos. That was no, absolutely not. And we certainly didn't color our hair. And look at how that has evolved. I mean, wow. A nurse could walk in, male or female, and they could be covered in tattoos, and they could have all sorts of color hair and be of any race or any stature. I'm gonna, as a patient, I would be very appreciative that there was a nurse there who was competent and willing to take care of me in today's time. But 20, 30, 40, 50 years ago, that was not so. You had to be very professional, and even back then, nurses wore skirts and skirts only. And anyway, I'm digressing with my point here. It's ever evolving. Professionalism is expected. If there is any misconduct, you are removed. Helpful advice for caregivers. You can read that. All right, and that's it for this chapter. Please outreach me if you have any questions. And yeah, I'll stop talking.